So, Dr. Michaelis, let's talk about some of the most common procedures that you are doing in the summertime. And I'm assuming it's kids because they're out of school, but what might that be addressing?
Yeah, in the summertime we get really busy. You're exactly right. Kids are out of school, they have some free time. Their dentist or orthodontist had told them during the school year that maybe they should have wisdom teeth evaluated. So we get a lot of people coming in. I call it the wisdom tooth season. It just seems that's the season we're taking a lot of wisdom teeth out. They come in for evaluations, not necessarily extractions, but we'll evaluate every person separately and individually and decide if it's in their best interest to have the teeth extracted or not. So as the summer goes, we tend to get really busy, and then around Labor Day when people are getting back in school, it gets a little quieter, and we have to wait for the next season's crops to develop before we can take those out.
So should every patient inquire and expect to have their wisdom teeth removed?
They should at least inquire. Yeah, I don't know if they should expect to have them removed, but I think the majority of patients, I think there's enough research out there now to support a strong consideration for having them out. There was an article in the Journal of Public Health recently that kind of said that oral surgeons are greedy and we just take teeth out and it's unnecessary surgery and we put kids at risk for surgical complications and anesthetic complications. But my society, the American Association of Oral Maxillofacial Surgeons, kind of rebutted that, saying that you can have wisdom teeth in your mouth that maybe aren't hurting, but that doesn't mean they're disease-free. You know, it's quite possible and often very common that the teeth are present and diseased. There's bone loss or a cavity, but the patients don't feel anything, so the patients think they're okay, but there's other things going on. It's kind of, an analogy would be high blood pressure. You know, people feel fine. Blood pressure doesn't make you hurt or give you headaches usually. But it can kill you. Right. You know, teeth, again, don't kill you usually, but it can feel okay, but there can still be disease around those teeth. So every tooth has to be evaluated, and we'll talk to patients and their parents about their options.